I'm Professor Antoine Bondu. I'm the head of the Department of Cardiology of the Hôpital Universitaire de Bruxelles, Hôpital Erasme in Brussels. So why is it so important to identify ATTR cardiomyopathy patient? First of all, is because we all see such patients in our daily practice. Nowadays, we have access to treatment that allow us to improve patient outcome. And we know definitively that early disease detection is associated with a better outcome for every patient. So we need to take care about this disease. We need to think about it. And we should try to identify those patients in everyday practice. So please don't stick to the first diagnosis that you get and think about ATTR amyloidosis. So what is the Belgian approach toward ATTR-CM patient? So to identify those patients, we have a rapid access toward multimodality imaging modalities. So it's quite easy nowadays to ask for a patient with an unexplained left ventricular hypertrophy, a nuclear scintigraphy that will allow you to identify a cardiac fixation of the tracer. And if it's the case, if you exclude adequately a circulating paraprotein, you can set up and already say that your patient has an ATTR cardiomyopathy. Of course, in challenging case, you will require cardiac biopsy that you could manage with the help of specialists in that field. And you should take care not to miss the right diagnosis for every patient. And once you need a more complex setup, please refer the patient towards a dedicated specialist. But you can think to this disease in your daily practice for every patient. So how to increase the rate of diagnosis of ATTR-CM in your country? First of all, you should increase awareness regarding this disease. That's at least what we did at the Belgian level, promoting and building campaigns regarding this disease in many specialties. So having saw this, we generate a kind of enthusiasm of many specialists regarding ATTR cardiomyopathy. Next to this, we collaborate together and set up discussion teams where we can indeed discuss about the diagnostic aspect, but also regarding the treatment aspect in order to do the best choice for every patient. And of course, one third aspect in Belgium is that we have a rapid access towards every diagnostic modalities, and in particular regarding nuclear imaging, but also for cardiac MRI. So it's one of the elements that potentially accelerate the diagnostic rate in Belgium. So the multidisciplinary team is key in managing those patients for many aspects. First of all, regarding the diagnosis for the patient. So we know that for some patients it's quite straightforward. You have a positive bone scintigraphy, you have no circulating paraprotein, a grade 2, 3, then you can do this diagnosis easily. For others, you need to discuss because there are sometimes some circulating paraproteins, there are sometimes mixed case, there are sometimes cardiac and neurological involvement, so you definitively need to discuss with other specialists. Take care that those patients also have frailty, which is quite frequent, so you need to involve geriatrician, you need to involve internist, you need to involve hematologists for some point, so you definitively need this collaboration between specialists. Also, I would say never forget the general practitioner, which is sometimes one of your best friends to manage your patient, because he will follow your patient for the rest of the time, and so you need to involve him also in the patient management approach. I think the most challenging part in increasing diagnostic rate is first to demystify the diagnostic algorithm. When you look at this for the first time, you have the first impression that it's quite complex, but this is not. So if you take a few minutes to look at it, you can realize that it's quite simple. Once you have a positive bone scintigraphy and an absence of paraprotein, you can do the diagnostic of ATTR cardiomyopathy. So I think all of us can do this diagnosis in our daily practice, and we should definitively see this algorithm as a simple tool, and if you follow it clearly, there is no doubt that you will get the right diagnosis for the right patient. So that's one of the first aspects. Maybe the second one is that we definitively need to increase awareness regarding this disease, and we should all of us think about it in our daily practice. Sometimes it's just a paroxysmal atrial fibrillation, sometimes it's just an AV block, sometimes it's just heart failure that will hidden this disease. So you should always question why this patient presents such a diagnostic feature. So we should challenge the diagnostic of every patient. We should search for this disease beyond the first line diagnosis, and if you do so, you will find patients in your daily practice. So regarding the hopes that we can have today, we know that having access to more treatment and having a rapid access towards treatment, we can definitively hope to increase the quality of patient management and patient outcome. So of course tafamidis was like a bomb in the field for cardiologists, and we know that it's the first drug that is able to treat this ATTR cardiomyopathy. And nowadays, building knowledge around this and also getting access to real-world data, we can definitively increase the quality of care we can provide to every patient in daily practice. Also, we should be aware that there are many developments in the field of diagnostic, and if you think about artificial intelligence, there are tools that are nowadays developed that could lower the threshold for disease detection. And this could definitively help us in managing early patients, in identifying early patients, and even for pre-symptomatic patients in the case of familial disease.